like that where you feel trapped and you can't get out and it's miserable. You just want something to numb the pain. And so that's where people usually go. I often find that in families, the coping mechanisms that we have are usually passed down. So how we see our parents and grandparents cope with things is usually the way we learn how to cope until you get new information. So if Tony was talking about our eating patterns, she talked about the family dynamic of how they ate in her family. I know a lot of her family, like a lot of her family. And they like to eat. I go to the family reunions, they like to eat some good stuff. But she realized she had to change her patterns because that was the pathology in her family. They ate like this and it wasn't healthy. It's the same way for how we learn how to cope and deal with bad situations. Newsflash, bad stuff happens to everybody. Bad stuff is gonna happen. You're not gonna be the first person for something bad to happen. What you need to learn is, how can I bounce back and overcome this situation? I often equate our mental health and our mental resilience to working out. We know that in order for you really to gain muscle or to see progress, you're gonna have to kind of tear the body up or go through something that's uncomfortable or painful to be stronger. And so if you never go through anything, how do you expect yourself to actually be stronger from a mental standpoint? You have to have that resilience built. Look at people who've never really had adversity. And the minute adversity comes, it's almost like they crumble, right? And you're like, your life has been good, nothing bad has ever happened to you. Like you should be cool. But no, what happens is they don't know how to bounce back against that because they've never had to develop those emotional skills. So I'm not saying that your bad situation is a blessing per se, but I'm saying it's part of the journey to make a better version of you and to make you stronger. And so that's a different way to look at that particular aspect. All right, next slide. We're going to talk about risk factors.